about the heart tube? You know there are 5 parts of the heart tube, you remember them? Let us draw the heart tube, the 5 parts of the heart tube. Now, you see, right and left horn of the sinus venosus will bring the blood into the primitive atrium, into the primitive ventricle, and into the bulbous cordis, and the blood will exit at the truncus arteriosus. Let us discuss it by drawing ourselves. We draw the heart tube now? Yes. Okay, let us do it. So this is going to the heart tube, and the heart tube is having some input channel, and then there is some output channel. Now, when you are talking about the input channel, it is basically some blood coming in, and that will be the right horn of the sinus venosus, and then there is also the left horn of the sinus venosus. So this is the left horn, this is the right horn, and the blood is coming, venous blood is coming. So when you're telling that venous blood is coming, where is the venous blood coming from? If you're telling that this is the right horn and left horn of the sinus venosus, fine, but they receive blood from where? From the 3 sets of veins. Which 3 sets of vein will drain here? That you already know the names. We will write the names. They are called as the right-sided cardinal vein, and right-sided the vitelline vein, and also the right-sided umbilical vein. Not only it is on the right side, but also on the left side. So they are on the right side, left side, yes, and draining into right horn of sinus venosus, left horn of sinus venosus, yes. Where the sinus venosus will push this blood into? Sinus venosus will push this blood into the primitive atrium. If that is the primitive atrium, then where is the primitive atrium pushing this blood into? Primitive ventricle. And where is that primitive ventricle pushing the blood into? As you see, we have got the blood into primitive ventricle. Now it will push the blood into the bulbous cordis. And where the bulbous cordis will push the blood into the terminal portion, which is called truncus arteriosus. It is called truncus arteriosus because it is the arterial trunk. So it is the arterial trunk, yes. It will send the blood out, yes. Where is it sending the blood out? Actually, the blood should go towards 2 directions. What is the 2 directions? One towards the lungs, which is for oxygenation, and it will be called pulmonary circulation, and the other one it is towards the systemic circulation. So you are telling that some blood is moving towards systemic circulation and some is going towards the pulmonary circulation. Who is sending that? Of course, truncus arteriosus, but later truncus arteriosus will be dividing into 2 vessels, and which vessels are there, we have to find out. Which septum is there, we have to discuss all that. But I told you one thing, that who is the smooth inflow tract? The smooth inflow tract is, I believe, sinus venosus. Yes, correct. Smooth inflow tract. And who is the smooth outflow tract? The smooth outflow tract, I believe, is bulbous cordis. Yes, it is the smooth outflow tract. Actually, when you say it is the smooth outflow tract, it means it will form the smooth part of the ventricles. If it is forming the smooth part of ventricles, then who is forming the rough part? Actually, primitive ventricle and primitive atrium, they will form the rough and trabeculated portion. So rough and trabeculated portion of what? Of the 4 chambers of the heart. If you say 4 chambers, I can see only 2. How they will become 4? Because I see there is a primitive atrium, primitive ventricle. Later some septum will develop, and then there will be 4 chambers. So which septum is developing can we discuss? Let us discuss which septum is developing. But first you have to tell. What is the future derivative of the right horn of sinus venosus and the left horn of sinus venosus? Actually, the left horn of the sinus venosus will become very small, and when it becomes very small, then it will change into coronary sinus. And what is coronary sinus? Coronary sinus is collecting the venous blood of the heart. You are telling that left horn of the sinus venosus become very small? Yes. And then change into coronary sinus? Yes. Which is now receiving venous blood of the heart? Yes. Okay. Can we see some diagram for that? The diagram is coming up. Wait for some time. First tell me what is happening to right horn of sinus venosus. Right horn of sinus venosus? Yes. Actually, right horn of sinus venosus is absorbed into the posterior wall of primitive atrium. And when it is absorbed into the posterior wall of the primitive atrium, then the right horn of the sinus venosus is going to give us sinus venerum. So sinus venerum is derived from the right horn of sinus venosus. What is sinus venerum? Sinus venerum is the smooth posterior wall. The smooth posterior wall of the right atrium. If you say it is the smooth posterior wall of the right atrium, then who is forming the rough anterior wall of right atrium? So right horn of the sinus venosus is absorbed into the posterior wall of the primitive atrium to become sinus venerum, which is contributing to the smooth posterior wall of the right atrium. And who is forming the rough anterior wall? Anterior wall, rough anterior wall is, of course, primitive atrium. So primitive atrium is going to form the rough trabeculated portion of the right atrium. Not only right atrium, but also left atrium. Where is left atrium? I cannot see. Actually, you have to discuss some septum now. And one septum was developing. Some septum is developing now? Yes. What is the name of septum? Name of the septum depends upon the location where it is present. Depends upon the location where it is present means if it is here in the primitive atrium, you will call it as interatrial septum, dividing the primitive atrium into right atrium and left atrium. And what if it is the ventricle? Then you will call it as the interventricular septum. And if that is interventricular septum, it is going to divide the primitive atrium into the right ventricle and the left ventricle. Yeah, that is the job. You see, name of this septum depends upon the location where it is present. This is interatrial septum in the primitive atrium, which is dividing primitive atrium into right and left atrium. And what is the septum doing here? It is now called as the interventricular septum in the ventricle region, dividing the primitive ventricle into two parts, which are the right ventricle, left ventricle. Hence, you have four chambers now. And these four chambers of the heart are coming from primitive atrium, primitive ventricle. Which portion they form? Rough trabeculated portion. Then who was forming the smooth part of the ventricle? If it's a smooth part of the ventricle, then it will develop here and they will be called as bulbus cordis. So bulbus cordis is forming now the smooth part of the ventricles. What are their names? The names of the smooth part of the ventricles. Yes, we'll discuss them shortly. Not here. Not here, but after some time. Yes. Okay. We'll wait. What is happening here? Actually, there is one septum which is called as the episeptum. And why would you call it as the episeptum? You remember episeptum is derived from the neural crest cells. And when the neural crest cells were forming episeptum, it is going to divide the truncus arteriosus into two vessels. Which two vessels? The name of the septum says aorta and pulmonary septum. Okay, episeptum, aorta, pulmonary septum. Yes, in fact, what happens is the aorta pulmonary septum is dividing truncus arteriosus into two parts, and this will become the ascending aorta. This vessel? Yes. You mean to say ascending aorta carrying blood to the systemic circulation now? Yes, this is ascending aorta. And then you will see that the other one is pulmonary trunk. The other one is pulmonary trunk. You mean to say pulmonary trunk carrying the blood towards the lung for the pulmonary circulation oxygenation now? Yes, remember. There is one aorta pulmonary septum. Aorta pulmonary septum and developing in truncus arteriosus, and which is dividing truncus arteriosus into two parts. There is one ascending aorta carrying blood to the systemic circulation, and then there is one pulmonary trunk carrying towards the pulmonary circulation for oxygenation. But remember, this episeptum is not a straight septum, it's a spiral septum, and later it is also descending down into the bulbus cordis to reach the ventricles. What is happening? This episeptum is not a straight septum, it's a spiral septum. Okay, then the spiral septum is going to descend down towards the ventricle. You mean to say it is also going to divide the bulbus cordis now? Yes. And then it will reach the ventricle system. So this is all what you have to learn further. Shall I see one thing here? The right atrium is sending blood into right ventricle, is sending blood into ascending aorta. What is this? No, it is not like that. I told you AP septum is a spiral septum. So the vessels will spiral. So it will be actually ascending aorta going to this side and pulmonary trunk coming to this side. Oh, you mean to say this AP septum is spiral septum? Yes. And it'll spiral the vessel? Yes. Okay. So you mean to say what I see now as ascending aorta will be actually pulmonary trunk later? Yes. Ascending aorta will go there. Because this AP septum is a spiral septum? Yes. Understand. Right atrium send the blood into right ventricle, will send the blood into pulmonary trunk towards the lung. And the left atrium will send the blood to left ventricle towards the ascending aorta. But this is pulmonary trunk, appears to be in continuation. Yeah, that's what I'm telling. It will not be there. And what if the AP septum is not spiral, it is straight? If the AP septum is straight, then this is the anomaly. It is called transposition great vessel. So this AP septum, if it is not spiral, if it is straight, then there will be anomaly, transposition of great vessel. Means then you will find right atrium sending blood into right ventricle, sending blood into ascending aorta towards the systemic circulation, and left atrium sending blood into left ventricle and towards the pulmonary circulation. But this is called as transposition of great vessel. The vessel have changed their location. Why it happened? Because if the AP septum was a straight septum, then it will happen. Can I see some diagrams for that? Yes, we'll do that. But first to revise. Revise what? Can you tell me what is the right horn of sinus venosus doing? Right horn of sinus venosus, I think it was forming the posterior smooth wall of the right atrium. Yes, it is called sinus venera. Posterior smooth wall of right atrium. What is the left horn doing? Left horn became very small and formed coronary sinus to drain the venous blood of the heart. What happened to primitive atrium? Primitive atrium was forming the rough trabeculated portion of the right atrium and left atrium. What is the primitive ventricle doing? Primitive ventricle also formed the rough trabeculated portion of right ventricle and the left ventricle. Then who is forming smooth part of the ventricles? That is the bulbus cordis. What is the smooth part of the right ventricle called as? It is the conus arteriosus. Question mark was there. Conus arteriosus. And what is the smooth part of the left ventricle called? Smooth part of the left ventricle is called aortic vestibule. That question mark was there. It is aortic vestibule. And this all is coming from the bulbus cordis, the smooth outflow tract of the heart. Yes. And what is happening to truncus arteriosus? Actually, truncus arteriosus will develop AP septum to divide it into aorta and pulmonary trunk. There's ascending aorta on one side and pulmonary trunk on the other side. But AP septum should be a spiral septum. Now, once you have that idea, let us look at one more thing. It is called folding of the heart tube. I told you that the heart tube is straight in the beginning, but then it is folding and upper arteries come anterior and the lower veins remain posterior. Let us see that again. You remember what is the sinus between the two? Transverse pericardial sinus. That's what we have to discuss now. So what are we looking at? It is the straight heart tube which is then becoming folded, looped, and then it is converging. What is converging? You have to remember, in the beginning, the heart tube is a straight tube and blood enters from below venous end and exits from above arterial end. You mean to say this will be the sinus venosus and that will be the truncus arteriosus end? Yes, that is the point. And later you see what happens. The incoming channel, which is the lower venous end, which is sinus venosus end, is going to be posterior, whereas the upper arterial end, which is truncus arteriosus end, will be coming to the anterior side. So you can see now, upper arterial end is coming anterior, and the lower venous end is now going posterior and posterior. So veins go posterior to the arteries anterior. Yes, and what is this space? You remember? That space will be called as transverse pericardial sinus. Transverse pericardial sinus. So we want to see that also. Now, as you continue further with the development, you will find that what we are looking at is the heart tube having 5 parts. And what are the 5 parts of heart tube? There is the incoming sinus venosus, primitive atrium, primitive ventricle, and then you have the bulbous cordis, and the exit point is truncus arteriosus. 5 parts of the heart tube. Actually, what I want to understand is upper arteries coming anterior, anterior, anterior. Upper arterial end coming anterior, 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 and the lower venous end going posterior, posterior, and posterior. So you mean to say right horn and the left horn of the sinus venosus is going posterior, posterior, posterior behind the heart now? Yes, I want to look at that now, because I want to see what is the derivative of right horn and left horn of sinus venosus in the diagram. And to see the derivative of right and left horn of sinus venosus, I must look at the developing heart from posterior side, because veins are going posterior. So can we see the posterior view of the heart? Yes, it is here. What is this? This is the right horn of sinus venosus, which is seen. And where is the left horn? Left horn is here. Why this is left horn? That is left horn because you are seeing from the posterior side. This is posterior of the heart. So this is the right horn of the sinus venosus from the posterior of the heart. What is it doing? You remember what it is doing? It is going to get absorbed into the posterior wall of the primitive atrium to form sinus venerum. What is that? Posterior smooth wall of right atrium. Then we will form the rough anterior wall of right atrium. That will be the primitive atrium. So primitive atrium will form the anterior rough wall of the right atrium. Yes, because the right horn of sinus venosus is absorbed into the posterior wall of primitive atrium to form the sinus venerum, which you can see now here. But this is the left horn of sinus venosus, which will become very small and become the coronary sinus of the heart to collect the venous blood of the heart. Now let us look at the further diagrams. See, this is the right horn of the sinus venosus, and it is forming sinus venerum. What is sinus venerum? Can we magnify this area? Yeah, let us magnify this area. This is the sinus venerum, which is the posterior smooth wall of the right atrium. If that is so, then what about this rough anterior wall of the right atrium? If you say rough anterior wall of right atrium, it will include the right auricle also. It will include the right auricle also, and that is contributed by the primitive atrium. Actually, it is the primitive atrium which will form the rough anterior trabeculated portion of the right atrium. What is the boundary line between rough and smooth part? Magnify. As you're talking about the boundary line between the rough and smooth part of the right atrium, it is called as sulcus terminalis from the outside, and it is called as crista terminalis from inside the chamber. So inside the chamber it is crista terminalis, some elevation, yes, and on the outside it is some depression, sulcus terminalis. Yes, that's the point. So can we see the crista terminalis now? Of course you can see crista terminalis. Wait for some time. At this moment you tell me what is happening to the left horn of sinus venosus. I think left horn of sinus venosus become very small. Yes, and then it will become coronary sinus. What is coronary sinus for? Coronary sinus, I believe, is receiving some venous blood of the heart, some cardiac veins draining the heart, and as the cardiac veins drain the heart, it will drain the coronary sinus, and then coronary sinus will drain all the blood of the heart into posterior wall of the right atrium. Posterior wall of the right atrium. Who else is opening in the posterior wall of the right atrium then, along with coronary sinus? If you're telling that it is going to become coronary sinus and open in the posterior smooth part of the right atrium, which is called sinus venerum, who else is draining there? Superior vena cava, inferior vena cava. Who is forming superior vena cava? It is anterocardinal vein. Who is forming inferior vena cava? It is the posterior cardinal vein. So posterior cardinal vein form inferior vena cava, and anterior cardinal vein forms superior vena cava. Where are they opening? Into the smooth posterior part of the right atrium. So you're telling that there are three openings in the smooth posterior part of the right atrium. What are the openings in the left atrium? Left atrium has four pulmonary veins. And where the four pulmonary veins developing from one pulmonary vein. So you're telling that in the beginning there's one pulmonary vein? Yes. And later there will come four pulmonary veins? Yes. Where the four pulmonary veins open? Four pulmonary veins will open into the posterior wall of the right atrium. This is the posterior wall of the right atrium. And who is forming the posterior wall of left atrium? This is left atrium. So posterior wall of the left atrium is a controversy. What is the controversy? It is mentioned that posterior wall of the left atrium is contributed by the absorption of four pulmonary veins. So you're telling that four pulmonary veins are getting absorbed partially into the left atrium? Yes. Okay, so there was one pulmonary vein formed and then it is forming the four pulmonary veins and part of them is absorbed into the left atrium to form the smooth part of the left atrium? Yes. On the other hand, there is other school of thought. What is that school of thought telling? It is telling the reverse. It is telling it is a left atrial wall which was forming the one pulmonary vein and forming the four later. So you're telling that left atrial wall was forming one pulmonary vein and forming four pulmonary veins like that? Yes. Who is forming who is a controversy. One book says there's one pulmonary vein forming four pulmonary veins forming the posterior wall of the left atrium, and the other school of thought is the reverse. Means the wall of the left atrium form the four pulmonary veins. So it is quite controversy. And nothing is clear. You have to practice MCQs and just find out your answer according to the question. So that's why practicing MCQs is quite important, which we'll be doing, of course. Okay, what is this? If you're telling that four pulmonary veins will open into the left atrium, how many veins open into the right atrium? Three. Okay, can we see these three veins opening into right atrium from the front view? Because this is posterior view. Yeah, this is posterior view. You want to see them opening from the front view, then you have to open the right atrium. Open the right atrium now. Open the right atrium and look inside the right atrium from the front view. Anterior view of the heart. And that is here. So this is where you have opened the right atrium. What is this? This is the rough anterior wall of the right atrium. Rough anterior wall of right atrium you have opened like that. Yes. And that's yellow color. That yellow color is the smooth posterior wall of the right atrium. And what is opening in the smooth posterior wall of the right atrium then? This, the three veins. What are the three veins? Superior vena cava and inferior vena cava, and it is the coronary sinus. Opening in the posterior smooth part of the right atrium. I understand where superior vena cava, inferior vena cava coming from, some cardinal veins. But where is this coronary sinus coming from? Coronary sinus, you don't remember. There were two horns of sinus venosus. Yes. And it was the left horn of sinus venosus which will form the coronary sinus, which will open in the posterior wall of the right atrium. And what is happening to the right horn? You remember, right horn was absorbed into the posterior wall of the primitive atrium to form sinus venerum. What is sinus venerum? Smooth part of the right atrium posterior wall. And who is forming rough anterior wall? That is coming from the primitive atrium anteriorly. It is rough and trabeculated portion. This is rough and trabeculated portion. What is the boundary line between the two? If you see from outside, it is sulcus terminalis, and from inside the chamber, it is elevation called crista terminalis. So inside this crista terminalis, but outside this sulcus terminalis. Yes, a question comes now. What is developing at the upper end of crista terminalis? What is developing at the upper end of crista terminalis is SA node. Where is SA node present? Myocardium, endocardium, or epicardium is a question. Gray's Anatomy says SA node is present at the upper end of crista terminalis and the subepicardial region. But subepicardial region is not in the option. What should I say? If subepicardial region is not an option, then you have to tell that it is developing in the myocardium. Some books say it is developing in the myocardium. So what is the question? Question is, where is SA node present? You should say subepicardial region. If not in the option, what is the second answer? Then you say it is in the myocardium. So I say no, it is in the myocardium. Yes, it is written by some of the books, but not Grey's Anatomy. Okay, what is the answer to this question? It is asking us true statement about sinus venosus. Sinus venosus. Okay, the smooth inflow tract. Yes, smooth inflow tract. What is it doing? I think sinus venosus is contributing to, yes, the sinus venerum. Yes, that's correct. Sinus venerum, which is the smooth posterior wall of the right atrium. Sinus venerum. Now, if you got your answer, fine. Who is forming this? The rough anterior wall. Yes. Primitive atrium. So that will be primitive atrium. Yes. But sinus venosus will form the smooth posterior wall of the right atrium. Yes, that is the answer. Keep the answer. Sinus venerum is the name.